Hello, dear friends, homeopaths. This is Homeopath Sapiens, Barbara Liberowicz, and my guest tonight is Dr. Helmut Roniger. Welcome. I think we met long ago in London, in Royal London Homeopathic Hospital. I guess it was 2007.
That's very long a time ago now.
And I remember we met at some pub and you came by bike.
I still use my bike. I try to stay fit. I'm living now in Kyrgyzstan,
Oh my God.
because I married a Kyrgyz woman, and I was invited to teach here at the University Medicine and to do some cancer research. That I'm preparing at the moment. And it's quite a unique experience. I'm learning Russian. I have got surrounded by a very big family of my wife with step grandchildren. It's a very mountainous country with beautiful nature. Now very booming economy, which is a different experience than what would experience at the moment in Europe, where everything is a little bit subdued. It's an adventure.
I would like to go back to the time you spent in London, in Royal London Homeopathic.
I worked in London at the Royal London Homeopathic Hospital, or later called the Royal London Hospital of Integrated Medicine, for 23 years, and was a consultant there. I'm obviously not only a homeopath, I'm also a physician, internal medicine specialist, and studied Chinese medicine and acupuncture and hypnosis, was very much engaged with homeopathic research. I was part of ISHI, which was funded by Boron, and we met every twice a year. And if we met in 2007, that was just before what probably my main achievement in my homeopathic career, I would say, which was that I got Dr. Bracho, the Cuban doctor, to publish his trial on leptospirosis in our homeopathy journal. We published that in 2010, the trial was actually conducted over 2007 and 2008. And that was probably the largest homeopathic homeoprophylaxis trial ever conducted, even the largest homeopathy trial, if you count homeoprophylaxis as a significant part. It's a little bit controversial, but because it's more like isopathy, they gave basically a 200C and 10M mix potency of four different main species of leptospirosis to a population in three provinces in Cuba, after they had observed a major increase in incidence in these three provinces, more than the previous 10 years. And they didn't have enough vaccines. And within 3 weeks, the case rate dropped in these three provinces. There were 2.3 million. That case rate dropped down to the normal average. Whereas in the other provinces with 8.5 million people, the incidence, as expected and over the other years, went up. So it was a very significant shift. And this effect lasted for until the next year as well, when in these three provinces, which are normally the worst affected provinces, there was a very significant lower incidence in leptospirosis. Unfortunately, it was completely ignored. And part of this group was also then a review work of randomized controlled trials in the effectiveness, and I was very deeply involved in this review work, where we were part of a team of many outstanding homeopaths who would go through research project and classify them according to their rigor and their results.
You mentioned you were a consultant physician, so
Mhm.
you consulted patients with chronic diseases, as I can understand, in Royal London Homeopathic Hospital. Is there any special field of internal medicine you were interested in?
I was always interested in complementary cancer. In the homeopathic hospital, I saw a lot of inflammatory bowel disease patients. So I was more or less the go-to guy for the inflammatory bowel disease patients.
As far as I can remember, you have no luxury of case taking for 2 hours. So you have to be quite disciplined. And if you have patient with chronic disease like inflammatory bowel disease, you have to be quite precise in case taking and focusing on special symptoms. So, what was your approach to these conditions?
Well, I mean, as you said, our time was very limited. We usually had 45 to maybe maximally an hour for a first case, new case, and 15 minutes to 20 minutes for follow-up. And these were always very complex cases. So you always had to go through first to the major complex normal history and then had just very little time to really take then a homeopathic history in the rest of the session. So I worked very much with nosodes, yeah, and so tuberculinum, and in these cases was often indicated that the different forms of tuberculinum are used obviously when Mercurius corrosivus or Mercurius solubilis was a common remedy. I used phosphorus, of course, in some cases. So there was these kind of depending on what came out in the personality traits and one had when you take the history and the impression of the patient, but one didn't have much time to. And the other problem in the homeopathic hospital was obviously that the follow-up was not close. Yeah, we didn't have the luxury to follow up our patients closely. We had at best maybe a 3 months follow-up afterwards, and we were just the fifth or sixth wheel on the wagon, so to speak, because they saw other doctors in between. So to work as a doctor at the homeopathic hospital in the NHS setting was a difficult experience. You didn't have the same experience as you have in private practice, where you have more time and can follow up these patients closely.
I recently visited India, and if you talking about fast case taking,
Now that you mention it, yeah. So my kind of case taking was very much according to the Calcutta School of Medicine, yeah, in homeopathic medicine, because in Calcutta you have got these clinics where they stand in line outside the homeopathic clinic. But he basically always had a prescription strategy, usually a nosode in 200C, yeah, maybe sometimes in 1M, then as a follow-up particular. It was often in these kind of particular with inflammatory bowel disease, was often tuberculinum, sometimes syphilinum, if there was kind of very big destruction. And then there was often something like mercury, and maybe then a third in very low potency, something which was a local symptom if they had. And that was basically decided within 5 minutes. Yeah, so on a very, there was no, and he seemed, I mean, I saw a few cases. I saw in this 1 month, I saw one case of squamous cell carcinoma of the tongue disappearing on high potency of arnica, yeah, because it was typically had a bit on the tongue on the side because he had a problem with one of his teeth there. And this on that kind of keynote, arnica was prescribed and was quite extraordinary that without radiation and obvious a properly diagnosed squamous cell carcinoma of the tongue shriveled away within a month on daily 1 m, I think what he gave Arnica Montana. So that were quite impressive early impressions on homeopathy before I properly studied homeopathy, because at that stage I was just knew had passed the Augsburg course of homeopathy, and after that I went to India for 4 months. So it was a very fresh, a freshly recruited homeopath. So the yeah, so the work in homeopathy at the Royal London was uh, uh, more this kind, or keynote prescribing, very quick assessment.
Tell us about your current activities in the medical field.
So currently, I'm enjoying to teach Pakistani and Indian students in their final year clinical medicine. This is a 3-week intensive course of all chronic diseases where I go from two groups of usually a group between 12 and 14 students for 3 weeks. And that is just part time. It's like a hobby. First time that I teach students, I've always taught only postgraduates, and yeah, I enjoy that. But this is, as I said, just a hobby. And the other thing is, I became very interested in fasting and ketogenic diet about 10 years ago, and nearly 11 years ago now. I did a Harvard course uh, in cancer medicine, an advanced course, which was mainly for reason uh, to for drug developers. Yeah, and I was the only complementary doctor there in the course. And during the course, we had then to write a project, and obviously, I took a more complementary topic to write my dissertation, my little project on, because I discovered a book by Professor Seyfried, who interestingly is also located in Boston, but at Boston College, which is about like 5 miles away from Harvard. And he has developed a theory of cancer as a metabolic disease. And what Professor Seyfried discovered is, yes, of course, there are all these excessive mutations, no doubt about that. But the linchpin for them to actually happen is the failure of the mitochondria. And in the meantime, this is now 10 years ago, there's more research about this. And last year, they published a study on glioblastoma multiforme, which showed that if you can follow a ketogenic diet, with ketogenic diet, you basically can starve the cancer of sugar, which is the main driving force, because cancers basically ferment only and don't can have a very much lost ability to respirate. And glioblastoma multiforme, which is with the best normal therapies after debulking and radiotherapy and a little bit of chemotherapy, have a median survival between 12 and 16 months at best. 95% are dead after 5 years. And in this study, they found that if you can follow a ketogenic diet, after with very strict ketogenic diet, you can nearly triple your survival. So not a few months longer survival. The ones who could follow it lived 44.5 months, and 4 were still alive at the end of the study, which means at least nearly 2.7 times longer than the ones who couldn't follow the ketogenic diet for 6 months. And many other cancers, it's now there are cases where it also helps. And we want now to do a study on pancreas carcinoma and triple negative breast carcinoma. The good news is it's something you can use in end-stage cancers, which are basically not anymore helped or hardly helped by conventional drugs. So we will do that hopefully next year. Now, this year we will just develop the protocol and create the research team. The university here is not that research orientated there. That we still have to build the infrastructure and the staff, train the staff for that. So that will be my challenge for the next 6 months. Funding has been assured by the vice premier, who was the former ambassador of Kyrgyzstan in London and became my friend, and who invited me actually to Kyrgyzstan to do this. So that was one of the reasons why I moved to Kyrgyzstan, because I thought Kyrgyzstan is a country where they cannot afford expensive treatment. And this is and are maybe not yet as captured by the conventional pharma industry as we are, yeah, where we are very constrained in our research activities. When you go researching complementary medicine like homeopathy or lifestyle intervention like diets.
From your perspective of all your clinical experiences ranging from traditional Chinese medicine through homeopathy and metabolic approach, so what would be ideal health approach for current civilization problems with the health of society?
I do believe that the future of medicine lies in lifestyle medicine. Yeah, so because chronic diseases are caused by the wrong lifestyle, and we need to kind of shift our system to teach patients a healthy lifestyle, and then even longevity medicine for the healthy population to shift them to the ideal lifestyle, which we slowly start discovering, yeah, because we really didn't know very much about that. We now discover the importance of microbiome. We discover the importance of certain supplements. I do believe that homeopathy has still huge potential. We need to do a lot of more work to do it, and we probably will have hopefully more opportunity to research this when now the world has woken up to the corruption in our conventional system. Primary approach for chronic disease nowadays is to coach patients into a healthy lifestyle, do intermittent fasting, possible low sugar, even ketogenic diets, and use the other tools then as add-ons to that center of approaching chronic disease reversal. And homeopathy would be one of the tools which I would then also use.
Helmut, it was a pleasure. It was so nice to meet you after so many years. I think we just started, we opened the box with so many possibilities, and I hope to see you again in our homeopathic channel.
Will subscribe, and I will stay
And
in touch.
share, and share.
And I will share you my experience if this thing takes off on which I'm working at the moment.
Thank you and good night.